proper insurance coverage and limits are absolutely critical. It's going to help protect the district and our grantees. And can't say enough about limits. Our grantees, making sure that you're dealing with agents and brokers that know about the work and the exposures that you're going to be involved in, or whatever grants you're bidding on, will go a long way in ensuring the appropriate coverage and limits. Next slide, please. So insurance is mandatory, right? It applies to all our grants, services, construction, all projects on behalf of the district. This requires our grantees to be liable for any damages caused by their negligence. It's a critical part of any business plan. So, ORM sort of looks at it through the lens of, you should already have these coverages in place. In most instances, we would expect that you would have these coverages in place, the coverages that go out in our insurance requirements, that you would carry these as part of your normal course of business and not necessarily just in your dealing with the DC government. So again, that's why it's absolutely critical to have a good agent that has a thorough understanding of the types of work that you're going to be engaged in. Next slide, please. So medical services. These are based on this specific program, some of the services that we anticipate or that we have seen specific to this particular program. AIDS, drug assistance program, early intervention services, home and community-based health services, home health care. The requirements that go out are going to be specific and address these services that we're going to be seeing from this particular program. And we'll get into a little bit more of that as we move further in the presentation. Insurance coverage is mandatory. The government, I feel like we missed a couple of slides here. The government of the District of Columbia should be named as an additional insurer for work performed on behalf. Vendor contractors, grantees coverage will be primary and non-contributory, meaning that the grantees coverage will respond first without the expectation that other coverage will contribute. We must have a waiver of subrogation in favor of the government of the District of Columbia. And policy limits do not equate to the contract cost and grant amount. That's a question we get often is, well, why are we being asked for specific limits? These limits seem higher. Maybe the grant, maybe we're asking for $1 million, $2 million based on a grant that's not close to that. The coverage limits are based on the exposure and not the cost or the grant amount. So keep that in mind. The standard coverages that you're going to see on most contracts that go out are going to be your general liability, right? That's going to be someone gets hurt, your personal injury, damage to someone's property, auto liability, workers' compensation. So in the district, if you have 2 or more employees, you're required to have work comp. If you have less than 2 employees, or maybe you just have seasonal employees, or maybe you're a sole proprietor, work comp may not be necessary. If that is the case, and like I said, that you're going to see that standard on most of the agreements that go out. If work comp is not a requirement in your specific case, because keep in mind, a lot of these insurance requirements go out well in advance of the award. So you just send an email back, right? Communicate back through DOH, who will communicate that to us, and we can make, we can make an adjustment there and waive that work comp requirement if that's something that does not specifically apply to you. And then, of course, umbrella liability coverage, which is also critical, and that's going to go over and above. It sort of provides an extra layer of liability protection if you exhaust your underlying coverage limits. Cyber liability insurance. This may not have been, depending on how long you've been partnering with the district, this may not have been a requirement you have seen in the past, but going forward, you will see a cyber liability requirement. It's absolutely mandatory, and it will be in all of our contracts going forward. Cyber liability is critical. It assists with risk mitigation by sort of helping to offset costs involved with recovery after a cyber-related event. It helps with investigation, client notification, and recovery assistance. Often when you have a cyber breach, all 50 states, including the district, require companies to notify consumers when they experience a breach. And often that involves certain timeframes. It often involves other obligations in terms of, paying for identity theft services and so on and so forth. So having a cyber event can be significant. On top of that, the district has a cyber liability policy, and that requires that everybody partnering with DC also carries their own cyber liability insurance. And this particular slide doesn't have it, but if you look at the recent numbers, something like 75% of cyber incidents, cyber claims in the last couple of years have been from smaller companies, smaller businesses. So everybody should have a cyber liability policy now. And if you look at the average cost of a potential cyber breach for a small business, which $3-4 million, that can be significant. That is significant. And there's a lot of businesses, a lot of smaller businesses that can't necessarily sustain that. And one of the reasons the smaller businesses are targeted so often is because they don't always have the resources, the cybersecurity professionals and teams of IT folks protecting their network and their systems. So they're vulnerable. So cyber liability, and taking the long way around here, but cyber liability is absolutely critical and required if you partner with the district. Okay, here's a little bit more about cyber. I kind of got ahead of myself and covered this. We can. Here's some of the additional exposures that you may see: environmental liability, contractors, pollution liability insurance, medical professional. We earlier in the presentation we touched on some of the services that were unique to this particular program. So these are some of the coverages based on those services that you're going to likely see in the requirements. And depending on how long you've been partnering with the district, you've probably seen some of these already. Medical professional or professional liability insurance are some of the requirements you're going to likely see. Sexual abuse and molestation. So anytime you're working with children, at a hospital, in a setting where you have, disabled people, sexual abuse and molestation coverage, we often refer to it as SAM coverage, is going to be required. And you will see that on almost all the insurance requirements that go out. So that's another coverage to anticipate. One of the ways that we, and I do see some questions coming in, I'm gonna get to here in a second. One of the ways we verify compliance is with certificates of liability insurance. When we're dealing with DOH, who in turn is dealing with the grantee, who's dealing with their agent, you will provide us with certificates of insurance so that we can verify the coverages and the requirements are actually in place. The only exception to that will be the cyber liability policy, and I talked about that earlier. The cyber liability policy, we actually want to see a copy of that because there's specific language within that policy that we're going to need to look at and review. And we come across some folks that don't actually want to share that or send it to us. In that case, we can have a quick call. You can arrange that through DOH. We're happy to have a call with you and your agent and review any coverages or things that you have questions about. Here's an example of a certificate of insurance. Most of us have seen these. And again, here are the things that we look for. We're going to be confirming that the name insured is correct. One of the things that, and I mentioned this earlier, that we are going to verify, and one of the things that can cause delays is we need to make sure that the government of the District of Columbia is not only the certificate holder, but additional insured, and that there's a waiver of subrogation in favor of the District of Columbia. Often in the certificate holder field, I will see the individual agencies, right? So the Department of Health, for example, DC Department of Health. It's okay if they're listed there, that's fine, but it must also contain the government of the District of Columbia. And then this is our ORM team. I'm not here, so I apologize. This looks like it might be a slightly older slide. I did want to cover one additional point in terms of assurance coverage and adjustments. We are available to offer guidance. If you want to discuss coverages, limits, we're available to meet, of course, obviously through Department of Health, with you and your insurance agent. If you want to talk about coverages, things that you think may or may not be required or may not apply to you, we are happy to do that. Our job is to facilitate this, to make this move smoothly. We don't want to impede this from happening. If you need, if you have to get additional coverage and you have a quote or something that you want us to take a look at prior to binding to make sure that it meets the requirements that we put out, again, we're happy to do that as well. But just make sure that you engage us, through via the appropriate agency. We're always happy to help. This is our contact information here. Unfortunately, my name is not here, but I'll make sure that you have my contact information. I'll send it to Jennifer, and she can share that with you. We can also share copies of these slides with Jennifer, and then she can distribute them as necessary. But again, always happy to help, always happy to answer questions. And I think we had some questions come in during the...
Yes. Well, thank you, Adam. That was a great presentation. We do have a few questions in the box. So how questions will work today is you can either put them in the chat box and I will present them to the presenter, and then they will answer the questions. And if there's additional questions at the end and we don't get to, we will put them on the ORM site on the Effi Barry website, and you'll see that later on how to access it, and then how to ask questions and how we will connect you. So the first question is, what is defined as a cyber breach event?
Cyber breach event is any event in which data that you house is compromised, right? It could be names, it could be social security numbers, it could be any information that would allow you to identify somebody personally. Anytime that happens, each state has its own guidelines and regulations on how you're to respond to that, the time frame that you need to respond to that, and what you need to do after a breach. And the great thing about having a cyber insurance policy in place is that they assist you with all of that. They have your insurance company, your cyber insurance company has teams of breach response teams. So if you have a breach, a cyber incident where you have data or information stolen, you call your cyber insurance carrier and report it. They assign a breach team and they literally walk you through the process based on your state requirements in terms of notification. Here's what you need to do. There's an entire process involved in that. So having cyber insurance, especially in this day and age, I personally have seen, and a lot of this was prior to being with the district government. Since the pandemic, there has been an uptick in cyber events, and a lot of it's because we're all now operating in a remote environment, right? So a lot of these cyber criminals and so on and so forth are taking advantage of that, because a lot of the checks and balances that you would normally have from being in an office environment and face to face with everybody day to day has sort of gone away. So as we learn to adapt to this new remote environment, cyber criminals are kind of ratcheting it up a little bit. And it's, a lot of us are vulnerable.
All right. Thank you, Adam. The next question is, insurance is very expensive and can cost thousands of dollars a year, which can be offsetting for small businesses to work. So are we cut out of opportunities because of this?
So that goes back to making sure that you are dealing with an agent or broker that is familiar with the type of work or type of business that you're conducting, with the exposures that you have. Because if you're dealing with the right agent, they're going to have access to markets and access to carriers that are going to help minimize that for you. So while I can't tell you what any specific, yes, insurance is expensive, right? It isn't cheap, and depending on the coverages and so on and so forth, it can get very expensive. But unfortunately, depending on what you're doing, it's sort of the cost of doing business. But I think if you have the right agent and right broker that has access to the right markets, you will find that it may not be, in many cases, as expensive as you think, right? Some of these coverages you can address via endorsement. A lot of carriers have specific programs that are geared towards, specific events. So it might be easier for you to have cyber coverage, for example, endorsed onto an existing policy versus going out and buying a standalone cyber policy, which might cost you more. There are different things you can do. So that's why it's important to talk to your agent and broker and make sure that, you're getting the services that you need to be. And again, if we're happy, if you get quotes and things for coverages that we have asked for, and you want to have a call with ORM, with our office to talk about it, we're happy to do that, right? As long as you facilitate that through DOH, we are absolutely happy to have that call with you. And while we can't provide specific guidance on certain agents or brokers, there are websites and things with preferred DC partners that you can go to and find information that I think would be helpful for you in helping to select agents and brokers that will have these programs available.
Right, cool. So the next question is pertaining to the adolescent insurance. So they said you should anticipate this even if we don't serve children or minors. That doesn't seem physically prudent.
You're talking about the sexual abuse and molestation coverage?
Yes.
Yeah. So if you're working if you're working in an environment where you have access to children or disabled or handicapped, that coverage is going to be required. If you feel like you are in a situation where you are not doing any work at all related to elderly children, you're not working in a school or a hospital, again, that's a circumstance where you can reach back out through the agency and say, hey, here's our situation. We don't believe this applies. And then we'll review that. And we'll make a determination on that, whether or not it applies or not. So there's a little flexibility there, but again, it's going to be based on the exposures. It's not blanket coverage, right? So it is, we review these on an individual basis based on the scope of the work that you're going to be doing.
The next question is, can the $5 million limit on excess be reduced?
So potentially, it would be based off of, so if we put a $5 million umbrella limit and as a requirement, then typically it's there for a reason. Now, if you have underlying limits, like your GL limits, for example, or 2.2 or 3.3, then yeah, the umbrella coverage may be able to be reduced. But again, it's going to be on an individual basis. We'd have to look at it and make that determination based on that particular situation. So the short answer is yes. Yes.
The next question is, what was the discussion ORM had related to the financial impact? Increasing coverage would have the providers in the community. Costs have increased 3 to 4 times due to these new coverages.
So the coverages that we determine are based solely on the exposures, right? And protecting the district and also protecting the grantees, right? The coverages that we determine are appropriate are for this particular program and the services that are being provided. Not all coverages are going to respond to every incident, right? So if you have GL coverage in place and you have a cyber related event, it's likely not going to respond, right? Or if you have a work comp incident where you have an injured worker, your GL is likely not going to respond because most of those policies have exclusions in place that exclude certain coverages, right? So when we go in and we look at the scope of work that's going to be done, the time frame in which it's going to be done, and all of the exposures involved, we determine the coverage is necessary to respond to potential exposure. So again, if we put requirements out and there are questions about specific coverages and so on and so forth, we're happy to have that conversation. Just make sure that you arrange that through the appropriate district agency.
All right, thank you for that.
Absolutely.
And we do have a special guest who wants to make their appearance. So Jennifer is on as well. So Jennifer, if you'd like to share a few things. So she did add, she wanted to join, but I wasn't able to get it because we were in the middle of talking. So she did add, she says, hello all, Jennifer Pratt from OGM here. Please be reminded that the insurance requirements were outlined in the request for the application for the Ryan White Grant Program. By applying for this grant and accepting the award, your organization must meet the requirements outlined in the RFA. Please reach out to me at jennifer.pratts@dc.gov if you need to set up a call with ORM. She said she couldn't seem to unmute. That's why she just typed it all in the box. Thank you, Jennifer, for that response.
Absolutely. Thank you, Jennifer.
Okay, here. The next one is wondering about the auto liability requirements. Our organization is completely remote. No one is traveling anywhere.
So then that may not be a requirement that would be applicable to you.
And so what is the date when these insurance requirements are in effect?
So what happens is when I think Jennifer is raising her hand. Jennifer?
They are in effect upon accepting the award, but programmatic staff gave 90 days to come into compliance. And those are all of the questions that are in the chat box.
Okay.
And so does anyone have any other questions for Adam before we move on to the next speaker? All right. Again, thank you, Adam, for this great presentation. I'm sure folks will be reaching out to you with other questions and concerns. We'll make sure that we'll add your email address into the chat as well, so that if individuals want to reach out to you sooner, they'll have your email address.
No, thank you, Ernest and Health HIV. Jennifer, much appreciated. Appreciate the time today, and I look forward to hearing from you in the future.
Thank you. Thank you.
Take care.
All right. So next we're going to have Dr. Charles Brown, who is with Family and Medical Practices. Family and Medical, sorry about that, he is not with Family Medical. Charles is absolutely with Metro Health. And so Charles Brown is a family practicing nurse practitioner who is a board certified with the Academy of American Nursing Practitioners. Dr. Brown is currently enrolled in the nurse management practitioner at Metro Health DC, and he has the COVID vaccine and screening program for Metro Health DC. And he has their clinics for HIV prevention, treatment, and hepatitis C treatment, and is currently supervising the Metro Health DC Health Clinic program for a new men's shelter at St. Elizabeth campus in the District of Columbia. So Dr. Charles is going to be talking about compliance within their agency and how they came into compliance. So with further ado, Dr. Brown, the floor is yours.
Thank you, Ernest. Always good seeing you. Yeah, when it comes, there's two things that we practice at Metro Health when it comes to compliances with Ryan White services and things. We evaluate reports that we have from both the case managers and things that are upon the deliverables and service deliverables that need to be met in order to meet with the grant per se. So we evaluate those reports, we do what they need to be done and make sure they come into compliance. The second thing is in our organization, myself, data analysis girl, the chief of operations, we had made a dashboard where all our clients that are under Ryan White, we make sure that whatever the table A for outcomes is, that those things are met. So we have that dashboard. We make sure our staff is aware of it. We have our monthly meetings and things to that nature where everybody is on the same field. Then, you know, everybody's communicated, everybody knows what is expected. And we just go ahead and do what we need to do. And then it works for us. And especially, you know, some people are audio learners, some people are visual learners, you know, that whole thing. So that's how we pretty much come into compliance. And that's basically what it is. I'm sorry I didn't have a slide deck for you because I'm really busy. It's really busy up here and different things like that. And if you have any questions, just let me know.
Thank you, Charles, for that. Does any of the individuals on would like to ask questions of Charles? The floor is open. Okay, Charles, well, there are no questions in the chat box, so we will move to the next segment. And if there's questions that folks will like to ask of you, we will definitely forward them over to you to help with answering some of the questions.
Okay, that'll work, Ernest. Thank you.
And thank you again. We appreciate your time.
Sure, take care.
All right. So next is the Effi Barry Institute website. So on the Effi Barry Institute website, there is a section on here for Compliance Connection. So what the Compliance Connection is where you submit your requests or questions, and what our job here at Health HIV is to direct you to the appropriate entities to help answer and address your questions. So if it's a health department question, we'll direct you directly to someone that will be able to answer your question. And if it's a partnering agency with other agencies who've completed and surpassed this compliance, what we will do is we will connect you and partner you with that agency. And here is where you could add those requests, and we will respond accordingly as they come in. This platform will also have spaces where you could go on there and click on the links to look at, you know, most asked questions, or if you just have a question for the day or a thought that you want answered really quick. We look at these things on a regular basis. So as those things come in, they come directly to our emails, and we're able to respond appropriately and expeditiously. There's also the Effi Barry website, Institute website as well, and there's other trainings. So get a chance to look at the calendar and really look at what are some of the other opportunities and trainings you or your agency might want to participate in. And if there's none up there, there's always a space where you can go on and make a request for a specific training on the website as a funded entity under the DC Department of Health. Does anybody have any questions? Well, on behalf of the Effi Barry Institute and Health HIV and the Department of Health, we would like to thank you for participating. And again, if you have any questions, please don't hesitate to drop them in the chat before you log off or go to the website. and fill out the form, and we will expedite and respond to the questions as soon as possible. All right. Well, again, thank you, presenters. Thank you for participants, and you guys have a great rest of the day.